Hello, my name is Milta Little, and I am a geriatrician from St. Louis University Division of Geriatric Medicine. Today, I will be talking about how to enhance one's primary care practice by incorporating the annual Medicare wellness visits more effectively and efficiently. This video is supported by a grant from the Health Resources and Services Administration to help train healthcare providers how to better care for older adults. It's no secret that our population is aging. In fact, we expect to have such high numbers by 2050 that we don't expect to have enough aging specialists to care for these people. The geriatric workforce is declining. Therefore, it's very important that we train primary care providers to be able to adequately care for older adults. One way to do this is through the annual Medicare wellness visits. Here you see an aging trajectory. So as you can see, from the time that we are born up to a certain level, we are on the incline in terms of functional status. And right around the age 25 to 30, unfortunately for those of us listening who are on the other side of this, you start to see an age-related functional decline. Some of this is expected. However, there is a point where below the threshold, people become disabled. Unfortunately, as a geriatrician, many of the people that I see are already right at or below the threshold of disability. So it's very important for people to begin to assess patients well before this time in order to try to move that line and help to compress morbidity towards the end of life and prevent that decline towards disability. So the annual Medicare wellness visit is one tool that can help primary care providers to do this. There are three components to the annual Medicare wellness visit: a health risk assessment, a provider consultation, and lastly, a personalized prevention plan. So the annual wellness visit is billed in two different ways. There's the code for the initial or welcome to Medicare visit that can only be paid once per lifetime. More commonly, you will be using the subsequent visit code for the annual wellness visit that can be reimbursed every 12 months. So here I'm going to outline for you an algorithm that I think will help you to streamline this process in your clinic setting. I've color-coded it so that you can see that there are different components that can be done by different members of the team in order to make this a more efficient process. The top part of the algorithm, which is the dark blue, is the part that should be done before the patient arrives to the clinic. I believe that this can most effectively be done by a call center or a scheduling center with the help of the clinic manager. The teal part is the part that can be done by the person who rooms the patient, most commonly a medical assistant or a nurse. And then lastly, the light blue parts are what is done by the advanced practitioner, the physician, or a licensed provider under the direct supervision of a physician. So let's start at the dark blue parts and talk about what is it that you should expect your call center to do for you. So the first thing that I would advise is to have scripts available so that no matter who is sitting at the call center, the same information is given to the patients when they are called to schedule an appointment or when the patient calls to schedule. The next thing that needs to be done is to determine eligibility of the person, because if the person has already had an initial Medicare wellness visit, it's been over a year since enrolling in Medicare, or they've had their annual visit within the last 12 months, you will not be able to bill for this visit. There are two ways that you can assess for eligibility. The first is using your 270, 271 inquiries through your practice management software. This avenue is best if you're going to do batch inquiries. For example, if you would like to recruit existing patients to come for certain clinic days to do annual Medicare wellness visits, this is a nice way to look at multiple people to determine eligibility. The second way is to use your online provider service portal offered by Medicare, the Medicare Administrative Contractor. This is better for more infrequent inquiries. For example, if a patient calls and requests this visit, you can send this to your Medicare Administrative Contractor to see if this individual person is eligible for this benefit. Once the eligibility has been determined, the scheduler would then make the appointment for the patient, making sure that the patient understands that this visit is only for the annual wellness visit, will not be to address acute visits, and that the patient can expect to not have any copays. Then I would recommend that information packets be mailed to the patient so the patient knows what exactly needs to be brought at the time of the appointment to have all the necessary information at hand. There are many sample scripts available for you to use when you're calling the patients or when you're addressing the patients who have called in. This particular script is available in your resources. Please note that this is a copyrighted edition. If you wish to use this, you must receive permission from the authors. And I would also recommend that any script is tailored to your practice. The information packet that is mailed to patients needs to stress the importance of bringing in all the information so that it doesn't have to be acquired at the time of the visit. The necessary information to qualify for Medicare annual wellness visit is a review of past medical, social, family history, a full medication list including any over-the-counters or supplements, a list of all healthcare providers and suppliers for durable medical equipment, a comprehensive record of immunizations, and any record of screening tests that the person has had completed. Once the patient has brought in the information and it has been inputted into the medical record, the assessment portion will then begin. This portion can be done by anyone under direct supervision of the physician or advanced practitioner. Direct supervision means that the person must be in-house, not necessarily in the same room, and this can make it more efficient for your practice. The assessment must include the following elements: vital signs, both sitting and standing, height, weight, BMI, waist circumference, an evaluation of functional status, a safety screen, a cognitive evaluation, and an evaluation of mood. This assessment is the basis for the recommendations that are given to the patient by the physician or advanced practitioner. Now at St. Louis University, we have created the Rapid Geriatric Assessment that we believe is a good, rapid tool that can be incorporated into your annual Medicare wellness visits to do this quickly and efficiently and gather a lot of information. These tools have all been validated and can be used to track changes over time, which makes it very useful to be done yearly for your visits. Here is the Rapid Geriatric Assessment, all combined together in one. It consists of 4 different tools. The first tool is an assessment for frailty. The second tool is an assessment for falls and sarcopenia. Falls being one of the key safety factors we would want to address in older adults. The third tool is a simplified nutritional assessment questionnaire that looks for the risk of weight loss over the next 6 months. And the fourth and final tool on the Rapid Geriatric Assessment is the Rapid Cognitive Assessment, which is a brief cognitive assessment tool that has been validated to not only pick up dementia, but also mild cognitive impairment. All of these tools are available on our website at aging.slu.edu with training videos to accompany them. The last question on the Rapid Geriatric Assessment asks for the presence of advanced directives. There are many available web resources to assist your patient in completing an advanced directive. In addition to the Rapid Geriatric Assessment, it is required as part of the Medicare annual wellness visit to do a depression screening. We recommend the PHQ-2 as your initial screen because it has been validated to be able to quickly pick up depression in older adults. Some additional safety questions that are recommended: do you smoke? How many alcoholic beverages do you drink in a week? Do you feel safe at home? Do you have sex? And have you had any accidents or gotten lost while driving? There are many other safety questions you could ask, but we feel that these are the most important to be able to assess the highest risk factors in older adults. The last part of the assessment are the determination of age-appropriate screenings. It is very important that you understand what your patient has had up until that point and what is still appropriate moving forward. There are a variety of recommended screening tests for older adults, and there are recommending bodies that help to guide when it is most appropriate for your patient. I have included a table here that might be a resource for you when you're making your personalized prevention plan. The very last part of the annual wellness visit is the provider consultation and personalized advice. Of all the pieces of the annual Medicare wellness visit, this is the only part that must be done by a physician or an advanced practitioner or a licensed provider under the direct supervision of a physician. Again, this means that that physician must be present in the clinic, however, does not necessarily have to be present in the room with the patient and licensed provider. This part of the consultation reviews the data, creates a risk factor list, creates a screening schedule, gives personalized health advice and prevention plan, and then may or may not include an advanced directives discussion. An exam is not necessary at this part. A focused exam may be done in some instances, but is not part of this. If the patient is requesting a focused exam or an acute issue to be addressed, they must be advised either to make another follow-up appointment or that they will have co-pays and additional deductibles that may have to be paid out. Advanced care planning is an optional element of the annual wellness visit. Many providers choose to bring the patient back for a second visit for the advanced care planning. If you choose to incorporate the advanced care planning into the annual wellness visit, you may bill using either code. However, deductibles and coinsurance fees must be waived for the patient at that time. Although the Medicare annual wellness visit was not originally designed for non-clinic settings, we have successfully incorporated these visits into our nursing home population with the assistance of the facility staff to identify eligible patients. The rapid geriatric assessment was modified in this setting to include the FRAIL-NH Scale. This was validated to identify people at high risk of mortality, functional decline, falls, and hospitalizations over 6 to 12 months. Doing Medicare annual wellness visits in the nursing home setting can help medical providers and facilities ensure compliance with vaccinations, which is a 5-star requirement, begin advanced directive discussions with caregivers, and identify residents who would most likely benefit from hospice end-of-life care. A toolkit was created to assist nursing home providers to complete Medicare annual wellness visits, meeting all the requirements. In conclusion, the Medicare annual wellness visit is an important tool for general practice providers to increase revenue and adequately evaluate for and treat geriatric syndromes to improve outcomes for older adults. Currently underutilized, algorithms and tools exist to help practices to efficiently incorporate Medicare annual wellness visits into their workflow. Please visit aging.slu.edu for more information.